Mayam bukhumzari dom ding miribas Impact News ni ai Joyshree Usham na Impact News ki Impact Health Link for a Healthy Manipur program asida taram nokchari hauzi akhoi modern health care da mioi ba magi punsi kan ge haiba targadi magi layang pathabsi successful oina bai damakta akhoi test diagnostic test kaya marum tawba mathau tai aduga test tawba khakta na taba reports phangba khakta na taba yamna accurate oiba achumba afaba reports ki matung inna layang pathap chathara kodoni aduga mioi ba mai punsi kanba haibasi test reports tugi makha yamna poli aduna ngasi akhoi puzaragli ba topic asi role of quality diagnostic laboratories in modern healthcare hiramasida manunghuna hiramasida yam kopna akhoi gi miyam da thambina ba lengsin biriba guest na Dr. Ashangbam Vivekananda Singh, Managing Director Padma Diagnostic Center, Padma Medicare, Rims Road, Lalambung Makong. Dr. Butaram Nokchari.
Thank you.
Doctor, modern healthcare technological advancement mayam la hozik hidak makhan mayam lakle aduga equipments mayam leire adu behind all these doctors afafa mayam leire behind all these akoina diagnostic test toriba akoigi staff akoigi backbone ama oina leiribase magi importance yamna maru oiba adu doctor de khangjaning basi akoina diagnose tawba matamda karigumba aranba diagnose tawgiba taragadi magi consequence kari orakadage aduga akoina accuracy maintain tawba yam tangai fadab leiribase swice that khathambi
yani ahamba maktada impact tv bu ai isana ngasigi platform sida invite to bira ka appreciation uchari amasung viewers singbu khurumjari akhogi modern healthcare it has evolved throughout the years so jam chamkholabu matamda a recent study ta ise ngasagi clinicians singna diagnosis tawu matamda almost 75% of the diagnosis are ngasagi akoigi lab ki results sida depend tawraga diagnose tawe haibagi akoigi research papers myam phonge thaina di clinicians singsina ngasagi lab ki adyamna chawkhotpa oramdabagi clinically magi clinical skills tugi matung inna akoigi diagnose myam se tawrameba adu thaina so koi dum phagi oina hainai dena hek sida mihun hullaga mihun pairaga dum thaini doctor hida ma ekti e ana adu sigi poche hujik with the advancement si yarakta leire aduna hujik anova and the new generation of clinicians madam hoizo dum ubiram gani hujikti like ahama doctor gi manak chat pai je aduma clinically examine tawraga so side by side si x-ray lo ECG lo si ki test to si tawrai si gi behind the scene kari oigeda like now it is evidence based medicine akoina hekta si orambe haraga su like you have to be 100% accurate the fever ma to idang malaria na naira dengue ra natraga pinpoint tawraga patient da ju handaba like the sagi infrastructure leiba kholi myam ju wastage chatre dagi adugi pot da lakadoine ba like how important diagnostic results haibasi sida adum khangbiro 75% of the diagnosis da depend tawradoine ado si tawrakna ba honna ba amuk behind the scene ngasagi diagnostic lab sing si under certain condition under certain standard operating procedure da ngasagi test me hamse run tawdragadi like inaccuracy thoglagadi like clinician ju maithi doini the patient ki health to compromise tawrkadoine sigi pochida ngasagi role of a quality lab is very very important haiba pochida ngasi topic se yam matang chana pukhat pire ko quality control torokpa haise so we have certain steps first of all ngasagi lab ama lingat bada like the role of the authorities ekta mi amane hekta lab ama tawge natraga diagnostic center ma lingat ke whether yabra yadabra sigi guidelines myam state government ki myam health department ki guidelines to gi matung inna ngasagi lab se lingat bada like manpower kam leire what are the infrastructure the skill technician myam laurira natraga whether they are well trained si myam si government ki sagi regulation authority akoi Manipur ge na Manipur health department ko moina ayaba pira kanda mo lab se run tawgadoini adu tawro matungda lab run tawri basigi specific akoi gi standard operating procedure hai na koi gi SOP ma dom CD ko madam gi media da ji khang de koi gi kai quality matters se SOP da loi la ka doin ko aduna SOP sida yora kan da koina sample ama lak da ko maina receive tawgani patient degi ko maina sample do chinga doino whether they are being put in the right container
de hore ba mai
ge dom hogo de sampling do maming phajana tha ge bra patient dugi adu da su dom ona ba ya ga doine then when they are taken to the lab whether the machines are working functioning properly or not,
right
temperature labra magi right, whether the room that is keeping the machines humidity control labra, whether the reagents have been kept at the proper temperature in the proper refrigerators. See, mayam je mathang la kanda end result that thole ba report to the doctor duna based or kanda like they are taking care of their patients. See, hygiene adum mathang da adum asagi state mayam je dum hygiene ke asai quality control
mayam je maina khomaga behind the scene hojiki technician mayam jina phajana sample do study tor matung da adu dei phangpa report da base tor ga doctor na lying pathap se thak toine karam hidak sar ga kari phagani ha bese mayam aduna yam important oi ba soise alo doctor khangjaning baje mathang da hojiki akoina laboratory matung da magi quality se maintain toge ha ba tar ga di kari hojikti mayam doctor mahaki mawang da mayam di panbire ko temperature dei kai de atopadi external quality internal quality adugumba leibra hojiki magi SOP du matang na kitang sangdong na thambi
adu madam sigi matang si daina se haija doi se like ko gi lab process hai je aina broadly sarup ahum 3 parts the khaidok chage like pre analytical stage hai ba ma analytical and post analytical pre analytical se da aina panjagi ba ngasai patient du dagi properly sampling torba dima properly label tawba whether it was in the proper container adu toraga maje lab ta yor ka doine sample je lab ta analytical stage machine da chalaiba stage machine da gi toraga some results thola ka doine adu post analytical da ngasai gi machine da gi phangiba result do koi typist natraga na koi gi computer operator do na amuma proper magi report format enter to ga doine ko ada sigi stage ahum sida like if I am maintaining proper recording system in the lab, in case any inaccuracy thoga ju sigi phase ahum sida kadai da thoki bno komai thoki bno je thigat pa ngamgada bane ba koina aro sigi system si follow tawrba lab sing sida they like even if there has been any error somewhere we can always pinpoint kadai da swagi bno haiba potse plus koina ngasagi continuous education of the technicians natraga doctors CJ all throughout akoina ngasagi MBBS natraga MD tambajina para natraga na BSc lab technology tamgi du the para loiba natrim education is always an evolving area aduna from time to time we have to get ourselves this thing updated with the recent knowledge also aduna see am darka da technicians even the doctors the technicians anoba kari lakhre then hojik information technology chakhat pagi matung ina asagi akhoi gi lab management software and hojik every lab is almost computerized hanadi loina manually torombanina errors yam pagi chance wangba computerized toropagi madam hojik si adum asagi report thokpaju thugatle ade daidi amok ngasagi error ki chance lesson tore adu hairaga su like we have to be very this thing ngasagi stage hum do kadai da kari shoga da ge do adu madam na amok ngasagi external quality control internal quality control these are the most two important factors in managing a very high quality laboratory internal quality control haisina akoi lab isana akoi manung da tawjeriba thabak si accurate oirabra oidribra na pinpoint tawba yana bagi isagi program macha ma sinje ba koina masidai da koina ahamada tawri se like we have our own internal quality control ge samples kharale haidi akoina lab ki day hek horpada patient ge sample me amji yeng dringai da koina machine me amji on tawraganda machine me amji yaribra yadibra natraga whether they are functioning properly is komai khangani haibada akoina result already khangaba sample hai tar koi si adu industry da gi phangeba for example khoina kidney gi creatinine na lower sikwa creatinine gi sigi sample je hap da machine da gi tu tholaka dene haiba sample je machine da hap chala gi ngada
okay
adu ka ma tu thole okay the machine is functioning properly adu de akoi normal du gi laiba sample patient mayam gi do na adu hap kala ga du run taw yare suppose da hap chalu da mana 1.5 natraga 3 na thole en khala je then there is something wrong somewhere machine do oi doira technician do na sample chingapa volume soirira natraga hojiki sample je magi storage to the temperature to what lera phatlauna khoi don chatlaun ta thirani aduga amuk repeat to da amuk hojiki poto thokpham thoeba kaiguma thoktre then something is wrong then we have to take whatever measures we have to put the machine back in function adu kan da dang amuk machine map jaran to doini this sigumba sina koina internal quality control na haijeri se see every day adum routine noina to doini
no magi test holdringai da okay specific timing da dum to doini
aduga same time koina ayuk ta to ban marak ta to ban nungdang to ba they should produce the same result adai amuk madam na external quality control na haiba poche si jaina koina lab mayam sigi sample unknown samples mayam je koina third party amna sigi quality control program je run tawe for example all India Institute of Medical Science moi dege koi hematology blood ki sample je mayam tharaka doine koi lab hosigi program do yawo mayam je
okay
1000 lab 500 labs all over India koi jo one of the participating partner oraga de koi tharakani
okay
moi question ga sample do tharane koi da sisi sumai tumai to patient amagi sample ni sidagi noi sigi findings it or tharo ona akoi gi pathologist na result se yenga thagi doina da aduga up to every month ne ko the 3 months to walai adagi quarterly to usu lai sigi pot se tharga age duna amuk akoi na thagi result se chumi la le je tharaga adura amuk that means we are doing the right thing if something is wrong then again we have to go back check out kadai the soram ba yaga da ge haiba poto the mind this is an ongoing process I thought
this minus man internal as well as external mina routine checks it toina dum labs in tog je ko
every lab who wants to produce a very nice quality lab has to undergo this to compulsorily see yaug da basi I am loy tarwani lab ko but then again we have to be sure ki public ta ina pinning message se moina chat pada ju adum question to we idi nogi lab se sumaina quality control to ba lab la khola comment to bono khopono adugi knowledge to ninga si ina platforms da bijari se ko
adu doctor ji error gi wafum lak pada human error gi wafum lak pada haidi khoi mioi bani na dum soi ba je tambangam de aduna human error na maram oraga report da aran ba lak pa masigi chance se kamaina kyam wang bage do kamaina identify tawge sigumba incident lak matam da kari tawraga kamaina rectify tawna ba hona bage si joga thambi
adu human error as it is inevitable ko adu no natra no mata any lab other lab this lab my lab dom sigi problem da no natra no de ko dom thengna doine du thengsu thengnai ne ko adu human error is adu how to minimize it minimize kamaina tawni haiba pot to the emphasize to wadanga sagi when you have your standard operating procedures when you have your trained staff when you have your fixed protocol for any test procedure adu tadi human error gi sagi chances se para minimize to do ne ba adu tawre ana khalabok ta error thogla gadi like then we have to take the patient into confidence duga ngasagi referring clinician se referring clinician is the best person to fall back because mana patient duga maga interact tona doine akhoi da la isdi just a sample chi ma chet amaga requisition du da ira ka doine ko aduna sida communication is very very important whether with the communication with the patient party or whether with the referring clinician akhoi da report ama yam wang na lakpa natraga yam na nem na lakpa je adum thoe adu sigi pot se akoina adum counter check su tawrani aduga sometimes we need to call up the clinician sum case ama koi da smai lai akoina phangba da dcc result se lei ada doctor na sai patient du yeng bada clinically khoi report chi ga chana bara chana dabra chana ni har pa yawi ko kitang adu serana ba male then we will go back to the patient ma sai sample low basu yawi low draga su ko patient du da like whether the patient had come preparation nga sai lipid profile na koi heart ki yeng gi usually nungdang chara helaga ayuk ta laka da bane ba ado chara henda ba patient lakpa ju dum yawram mi ko aduna there may be some fluctuation in the results adaya koi fasting da loga da sample je patient duna adum charak te ja hai da bi da log ga di na hai ba ju dum yawi ado suma myam je amuk thiga ta ba ko adu me am ju tawraga in case something is somewhere is there, then we have to again request the patient for a resample.
Aduga doctor, see the patient ga center ma katang center ma sometimes report manada ba kitang kai numbering da kitang khena ba singulak ba cd swice the kari habi
si jo dum yaw da na tiam yaw ese adi patient party da chu ngasagi lab hunting ana moi je khoi da jomo tor mani tumel leisalani mai jom torni tumel leisalaga adum magi value me amse adum point da khena ba yaw yam error wang na khena ba dum yaw ko adu point gum da khena ba khona ba se adum as a clinician as a doctor akhoni yeng wadadi adum range samada lega di kaisu tok da ba value yaw pi adadi yam khena ba yaw pi ko sigi potse best judge is the clinician ade mangon da ulu do no ma mana sumaine point 1 ama point 2 ma khena ba je sigi potse ngasagi range tu gi manung da for that particular ngasagi test to adura yai habi yai adidi for example very critical value like serum creatinine and akoi kidney da sidadi point ama khena ra dabo adum patient gi up down chat pa ya ba le adudadi amu there is no chance of
error
see ya de ko adu lipid profile has cholesterol da sample amada 240 phange har se amada 245 phange haro that is almost
same range
log doine ba aduna mai parameter du pui but then again asa akoina haidoi se whether the patient had come prepared in the right condition when the sample was collected adidi collect toriba ngasagi akoi gi staff tu na ju ko akoi gi singli phangde kaina samaina ga leithat laga to busu dum yawi ko aduda adum for example serum electrolytes na koi test amale adudadi akoina sample je single prick ta thoro oina chingo ga ha adura sagi vein apik pada sagi tourniquet ka kisal laga tawda aduna jo error thon besu dum yawi bako
okay
aduna it depends on condition to condition aduna nga sagi aina haijai do nga sagi stage home de ekta lakane ba pre analytical da soira the machine da soira post typing da soira have a pot home ji da any good quality lab ti do amu thigat pangam ne ma de
typing da soibu dum ya thing yaw
adum yawe typing
human error da lakuta re ko
aduna dum khangdoi ne ba and then the next time aina haijai se communication je akoina patient do the show akoina haijai se like what we are doing is in the best interest of the patient akoi dagi chumna sengna thokiba reliable result na patient do health condition do afaba oisno na tawriba service ne akoina but then and there is a error we should have the courage to admit it akoina akoi lep tagi this choi ngai leite kaina akoina muka leiba je this should not be done. If there has been an error, we should admit it, and then we should also give the corrective measures. Koi lagi shoy karazu sini swaina sigi points da shoy bani, and then adu itardi amu resampling tower se sir madam. The patient side is adum consult tower ka lagu siam yawe ba. For example, koi gi medical fitness kumba lag pase. Particularly in the services ta laiba sibai gum je moi gi annual checkup lag pase. Moi masana abje haidok ta bida moi gi promotion issue laiba ko pase moi adum diabetes ka na raga su moi ji hidak te chasal laga kem ta haidok ta na lag ka doi ne ba. Som da sugar je chingkan da normal na ta normal le doi ne. Ni mi se kai ko thigol loga ko hang kan da moi da as da haidor ka doi ne ba. Som da dum thoi thok pade. ultimately there should be always two-way communication between the patient party, the clinician, and those doctors who are running the labs.
Doctor, for every ailment, another diagnostic test was important can be certain test can be
CG is like it's a two-edged sword.
Like doctor was already test of hard, you got test the Pashamzangani, last of the test normal or a mem harani, and it's mine have a gi.
CC don't tie Tadabudina, CG would say the way the modern medicine is evolving and the way the teaching is being done in the MBBS curriculum, Hosik Koina Tamakpa MBBS Matamgi syllabus ka Hosiki Anova new crop of doctors Hosik Tamibakango Zika Mo Amtina Kenareba. Madam is the Tainagi doctor D Adam Heck patients Lapaga, what I Saba Copa Adona 80% or 20% in a investigation the base or Matamamada. Hosiki patient examination 50%. Magi lab investigations mayam the 50% the 50 ani do toragana oina diagnosis to bagi sum I magi teaching train do na la abni na adu maino oina tare but koina kari haini in the positive way like normal mayam taramagasu sagi kaim anaba leramdre haraga oina harau tho su yai ko and then sagi Peshat tangi khole haibagi potse amo aina haija doise like private sector ga the government sector ga legre ko now the government sector gi chu hojik Manipur gi oina rimso fastly developing with almost all machineries like sale moida ayam loin tore adai akoi Manipur health mission gi chu periphery me amda blood test gi loina free da tore ko adai akoi private sector da luxury ba akoi gi chu adum akoina angamba adum government ki public ki adum akoi service tawjari private sector da tang isi gi di akoina any kai tawje akoida any incentive government side tagi healthcare gi oina hojibo kemta leite ba akoina machine MRI kang di CT scan kang di akoina import tawda import duty adai di akoina electricity loksale mo hairo Asidazu Kashu subsidy levanate everywhere private sector the government side tagi subsidize any incentives later nina everything has to be passed on to the public adugi kitang costly oina ubneba but then those who can afford may come to the private sector those who cannot they can go to the government sector the government sector am chapkale ko aduga asagi koigi Manipur gi hagada India gi as a whole akoi se naringai hakjang koi gi annual checkup ko mataw gi concept si huji bokte irei leiti da huji pudi tam tam ne awareness khare dila ana amuktang admaina check tok thok piba khotok pa na ba na da ba chahi gi amuktang tok thok pa ne na khanbi tai na sa gi unnecessary test irei kem toram de hai bido harau thok piyo kem leiram de hai bagi
okay guys doctor matang shwa da tin ba commercial brand long na kish
thank you
attend ba commercial brand logjage break matungda role of quality diagnostic laboratories in modern healthcare makhatana kamina kishi
Maidingu Institute of Aviation and Hospitality, Changangai Airport Road, Imphal. Admission open for new batch 4, Commercial Pilot License Training, Certificate Course in Air Hostess Training, Diploma in Airport and Airline Management, Diploma in Hotel Management.
Step into the world of luxury with Classic Hospitality Training Institute. Admission for 2025 is now open. Join our one-year hotel management course covering front office, food and beverage service, housekeeping, culinary arts, and workplace skills, plus a 4-month internship with the Classic Group of Hotels. Visit us at Hotel Imphal by the Classic, North AOC, Imphal West. Call 6909358685. Your journey to a great career starts today. Step into the world.
Break matungda amka hana taram nokchari ngasi akhona impact news ke impact health link da khana zern ba topic asi role of quality diagnostic laboratories in modern healthcare aduga akhoi expert guest na Dr. Ashangbam Vivekananda Singh, Managing Director, Padma Diagnostic Center, Padma Medicare. Dr. da break ki matung da lakching ba wang ngasi ngasai akhona quality control gi matang da internal oiba adagi test center na tok jaba mayam lai re adagi external haidra mapan dagi gi su mayam khana nai na swai doctor re khangjaning baje baje government gi site gi mo gi role je si kamai to boge inspection kum to yin chatpa adagi moina certification piba kum ba swai da kha thambi
the government is the for Manipur the state health department. State Health Department is the governing authority for any health setup in Manipur, including diagnostic labs, X-ray clinics, ultrasound clinics, even hospitals. Sigi guideline me like hospital run to you should have this many facilities. A number of nurses should be bed kimatungina. Bed masing asulay gadi hospital staff asulay gadam ni habagi. Amal jagre pla the koi diagnostic lab ki jo ngasai chalai doriba doctor do qualified oibra maje MD pathology ra biochemist la the microbiologist la natraga lab medicine gi doctor oibra oidabra adugi mathangda amok magi makada tok doriba x-ray technician je properly x-ray technician course duarga lakpa ngasai staff la the lab technicians me amje properly trained torga pass torga lakpa Singla ko adu mayam dugi list koi pikat ka doine then even koi biomedical waste very important issue ojik mayam thoknari dana genems ki koi gi sida chu amo Manipur pollution control board ki authority na laaga koi gi setup sida check tok doine koi dagi thadoi ba ngasai waste material mayam je ngasai biomedical waste management gi guideline do thugai bara thugai dabra then they will certify the X-ray thaman se then from the Baba Atomic Research Center atomic energy radiation gi magi room do radiation protection gi ngasagi check maron ani ga torga moi amalai guideline adu da tham adu maina torga follow tawbra tawdabra adega koi let ki apron ga leba adu let tabra koi staff so effect to ya ponte when a patient actagi natabada staff safety adedi koina sample handle tawbukanda staff singina dum kaiba khotpa glassware take pa adedi meta splash tawgiba HIV positive patient gi sample oiramagane adum leak tawba chatpa khutaga taiba khop yaudaba nateba sigi proper guideline lebra protection ki adedi whether akogi staff sing ji hepatitis vaccination tawbibra tawbidabra si mayam si loina pikhat ka doina koina authority da adu mayam do pure kanda moi inspection team la ka doina koida inspection team consisting of doctors of all kasagi specialty tawraga koina pikhali ba mayam chumila le on the spot verification tawrakanda a lab is allowed to function.
My routine checkup tauba masi protocol me am ngak ta baje dum to ina dum tauba
sigi je moya one time registration 3 years ki pi ko 3 years ki si hek loi ropada sigi je adum check tauba la ka doina adai adu tawr matang ade even koi gi fire safety measures labra building do my emergency exit labra leitabra adai fire extinguishers room khuding labra si loina check tawra kan dadang proper lab ama chalai bagi registration je pir kan dadang chalai doine ba adumain tawra loina ayamba Manipur da label lab sing je adumaina loina tawgadabane ba adula like then we are not sure loina mak tawi tawdi habagi ko sigi matang sida adum even media gi awareness amasu adum kaino da we sometimes see fly-by-wire type of operating small labs adum udabnati uiba moi sigi guidelines se torm mabudi I am not the authority to tell that sumba mayam ji public se aware obina ba ko adi lab ama chalai ba si ni edo
degi doctor ji hospital accreditation or lab ke accreditation lak pose season kamai to se adum mari liner
se adum mari liner aga sagi quality control torok pada aga sagi I know the Heiser Mams, I know Tawi and Alona, I don't quit them gang racing. Internal quality control, present Tawi, external Tawi, the idea guideline registration, you guideline a loina maxing that Tawi, sing acting Loinama, Izungaira, Mazungaira. She may have said Taurira Tokdira, Kananom, the Yingum Changeva. This is a simple definition of accreditation. Accreditation means
authority
akoina chumjariana tawjariba potse se chummenatra lale haibiru lao na akoina invite tawdoine ba body ama
okay
sida government ki adugi kaim leite agi lab chain chalai jai se sida aswanga yengbiru lao na akoina paisa ting na
invite tawdoine expert body ama invite tawba
sigi je akoina National Accreditation Board of Laboratories NABL ana lei ko India ki moiji da akoina sagi application thadoine aduga moigi team jina laaga third party assessment jo kawi basigi
okay
moiji jina laaga every nook and corner again na hairi bache cham yam duga toribo pochiga chummi lali en torga moina pura check torkanda enable accredited lab or in case of hospital NABH National Accreditation Board of Hospitals adu torga moigi Ojiki mogi litmus test pass torkana mogi silje pinam godoine now you are NABH accredited now you are NABL accredited and adugi stamp say yaur kanda like we are very proud as well as 100% sure ki whatever we are doing is as per the international norms haibagi
Dr. Ojiki Dr. MD Obiriba Padma Diagnostic Center, Padma Medicare, C accredited.
Accredited say like we are in the process of NABL accreditation right now. Aduga atai akoigi external quality control kay game am gi loina ma akoi loina pass to loire. Loina adu yaur ka. Aduga now we are in the process of doing the accreditation very soon. We are in the process.
Doctor akoina ayam matamda na doctor chatli doctor na nang je kari na no yeng thok se urine test or blood test or han doctor refer to kan diagnostic center chatli masina tabida akoina na rang sai doctor na takpi bo da chahi am da amuk tang anik an yeng thok padi yai have smile health package angon kari kari yaur bagi kari wat bagi have yeng thok pa yana bagi package kumba center is lay bibra
sigi se hoji yamna common oinare every center has now different packages ko women's fitness package men's fitness package the sports person gi and my torga koina we make a collection of tests it is routine test haitare yamna aruba nataba the complete hemogram the kidney lipid profile blood sugar ko and my torga package sema ga hojik se every lab masa gi amna hojik promote taunare aduga public na jo si ge yam well accept tawe hojikan adum yam lak ne re hojik se masa gi adum check tok thoke amtang isa budi kestu tok de amtang check tok thoke chahi na sigi concept
health conscious yam owner abani
sigi concept se yam phaba step ne na khanje ina plus sagi akogi health care akogi health insurance companies sing se sina ju mogi insurance policy sing promote to bukanda sigi package sing je moina mogi client sing da free da to bi moina sagi lab sing ga type torga mogi policy do yawi ba sing da aidi insurance company gi di policy claim torok ting moi di profit ne da so they want to keep their customers in a healthy condition aduna mogi policy yawi ba da moina test me am je free da thank you haraga moina free da loi to hondoi ne ba adudagi su sum concept se sum lak ma le hojikti there are lots of packages in every laboratory they offer and it's always subsidized from the MRP adu si adum mayam sigi
dong chaba lo bi yan
opportunities adum mayam lo bi anytime
doctor matam dilo shakle do loi dringai da hojikti artificial intelligence AI gi juk orabnina healthcare da every sector aduna hojiki especially for healthcare diagnostic lab kumada di AI gi magi influence magi interventions ji kamai lebe ge khatham
as madam AI haradi hojik se artificial intelligence it's influencing every sector ko hoji mayam la dum Facebook ta kai da adum mamai kharo onthok mamit kharo onthok tori mayam sinida these are all due to artificial intelligence but for the healthcare sector artificial intelligence is a big advantage as well as opportunity ko aduna nga sagi akoina artificial intelligence da indhokhraga diagnosis ki pot khara aidi India ki healthcare is always overburdened with cases oigidana koija aduna even akoina specialist kuma ka umada let's say ECG report ama tawbaje jiti AI da dum thado ECG hek lawraga adum cloud ta thado ga AI da tawraga adum khudakta adum magi report se adum within 2 minutes
adum madida error kumbagi
error ki chance later my algorithm amda pura semaga laigrabane ba aduna ngasagi simple case mayam ji ki algorithm da pura tawraga clinician nataga cardiologist da burden tawdabida jara dang thokraga kitang complicated case moina ngam da bududang ngasagi doctor duna focus tawraga de magi time do the patient management time management they amna huge advantage leba the even MRI reporting CT scan reporting even echocardiography se akoi cardiologist sing na tawbuje adum matam changi ni dana hujikti koi gi echo technician amana properly koi na tambiraga magi heart ki echo lowgi magi angle sing je tambiraga angle kuding magi image capture tawraga artificial intelligence ki mateng na jagi report se generate to ngam me ko
advanced
last we all may be overtaken by AI have ju mayamna kinabam di lai ko adu itarga ju like if we can handle it properly it's a huge boon for healthcare kage India gomba yamna overburden oiba from the ti ko
Yamno guys doctor matam pulo lochlakle lotion bada lorak bada doctor ramyam na kari message sambining bage
miyam da hangna hygienic is like medical fraternity as a whole including clinicians then we the lab professionals akhoi miyam na tori se ngasagi healthy society ma pukhalakna bani ko akhoi na thengnari si di ayamba narka da thengnai narka da lakta banak chakadoina aina presenting eba message se nahaloisi healthy lifestyle ko healthy food healthy lifestyle sida lairaga punchi sangna mayamgi lebaki kai sida saruk yaminaraga laimina se haina sigi message se mayam da presenting
Thank you, Doctor. Doctor, akoi gi ngasi program se Presto Enterprises Thangal Bazar na sponsor ta wibani aduna Impact News ki maike degi Presto Enterprises ki maike degi Doctor da thank you haina kudol se tamje.
Thank you Presto also.
Doctor thank you Doctor. Nasi gi di Impact News ki Impact Healthling matang shwalo shrakle matang ge cheol da atopa health ka hakshel ga mari leina ba topic ama expert ama galo na pun lak chege haraga miam dagi kanina ba ya thangni jari thank you
Institute of Aviation and Hospitality, Changangai Airport.